Nurs 480 Exam 3. Question 1. During a family conference, the nurse practitioner is leading a discussion with a family, which includes a 15-year-old adolescent who often forgets to check his morning blood glucose levels. Which question would be the most appropriate for the nurse to ask? Why would a person neglect his body? Can I tell you about the dangers of high blood glucose levels? Do you think forgetting to check the blood glucose is a way of acting out? I understand that you are all concerned with checking blood glucose levels. What are your specific concerns? Asking an open-ended, empathetic question facilitates discussion without placing blame. Question 2. When planning interventions for a family with rheumatoid arthritis, it is essential that the nurse include which family member in the discussions regarding treatment options. The child with the illness. The father as the breadwinner. The mother as the primary caregiver. All family members who are available. It is essential to include all family members who are available, as chronic illness affects the entire family system. Question 3. According to Nufel and colleagues' theory of normalization, families including a child with a chronic illness must perform which action to adopt a normalcy lens? Actively deny aspects of the illness that are unpleasant or burdensome. Focus attention equally on normal siblings and the child with the chronic illness. Recognize the ongoing processes of actively adapting to the child's evolving physical, emotional, and social needs and establishing new family routines. Advocate for the child at all times. Recognize the ongoing processes of actively adapting to the child's evolving physical, emotional, and social needs and establishing new family routines. Question 4. The nurse notes that a family with a child newly diagnosed with a chronic illness has no experience with the disease. Therefore, required routines and family life are disorganized. Which need is this family experiencing? Re-education, redefinition, remediation, realignment. They are experiencing a need for re-education. Question 5. The parents of a child with muscular dystrophy have a negative view of the child's future and feel hopeless about future care needs. Which view of the child is the family demonstrating? Thriving, enduring, floundering, accommodating. Floundering. Question 6. The nurse prepares to assess a family with a member who has a chronic illness. On what should the nurse focus during this assessment? Select all that apply. Sibling needs, core processes, nutritional needs, economic restraints. Sibling needs, core processes, economic restraints, developmental milestones. Core processes, nutritional needs, developmental milestones, economic restraints. Sibling needs, nutritional needs, economic restraints, developmental milestones. A, B, D, E. The nurse should focus on sibling needs, core processes, economic restraints, and developmental milestones. Question 7. While providing care for a family, the nurse reviews the common reactions of siblings to a diabetes diagnosis. Which statement is true regarding siblings of individuals with diabetes? Select all that apply. A. Some siblings feel pressure to be the good child. C. Most siblings feel shame-related embarrassment. D. Some siblings fear they will get the disease. E. Siblings often experience jealousy. A. Some siblings feel pressure to be the good child. B. Most develop behavior problems. D. Some siblings fear they will get it. C. Most siblings feel shame-related embarrassment. D. Some siblings fear they will get the disease. All of the above statements are true. A, C, D, E. B is incorrect because most do not develop behavior problems. Question 8. The nurse plans to use an empowerment model to plan care for a family who has a member with a chronic illness. Which type of care will the nurse use to support this family? Select all that apply. Problem-based, strength-based, evidence-based, patient-centered. Strength-based, evidence-based, spiritually relevant. Problem-based, patient-centered, spiritually relevant. Strength-based, evidence-based, patient-centered, spiritually relevant. A, B, C, D. The care should be problem-based, strength-based, evidence-based, and patient-centered.